Hello everyone, welcome to the MC Academy. In this session, we are learning about updates in the Dukes criteria for infective endocarditis. So this is the original document which represent the updates in 2023 Dukes criteria. So first we see the simplified version, then we see the original version of this updates. Yes, so this simplified version. So this updates in infective endocarditis include major and the minor criteria. Major and minor criteria. Major criteria include MIS, MIS, MIS. Major criteria include MIS, MIS. So M for you can remember M is microbiological, I for imagining, and S for surgical, S for surgical. Yes, so M is microbiological, I is imagining, and S for surgical. So these three are the major criteria. Three are the major criteria. Yes. Now first is microbiological. So microbiological include microbiology has a spelling MICROBIOL. So इसमें क्या आएंगे microbiology is a B and L. So B for blood culture, L for lab test. So microbiological include blood culture and lab test. Blood culture and lab test. Yes. So in blood culture include commonly the organism commonly causing infective endocarditis required more equal or more than two blood culture of the typical organism. Yes, or organism causing rarely infective endocarditis required more than three blood culture of the non-typical organism, and separate blood culture are required. Separate blood culture are required. Yes, so commonly organism causing commonly infective endocarditis. Commonly, so we choose the smaller number means the two. Yes, rarely, so we choose the bigger number means three. Yes, so commonly causing infective endocarditis. So we choose a commonly. So common is general term is more common term. So we use a smaller. We choose a smaller number two. Rarely. So we use some bigger number like the three. Yes. Commonly, so typical organism, rarely, so non-typical organism. This is blood culture. Yes, और next देखते हैं अपन the microbiology has a L. So L for lab test, lab test. So lab test include PCR. So PCR for the Coxiella burnetii, Bartonella, and Trypanoma species. Trypanoma causes Whipple disease. So how you can remember this? How you can remember this? Coxella burnetii, BUR, Bartonella, BUR, and Bartonella has the T. A T for you can start this trophanema. T for Bartonella, T for trophanema from the blood culture. Or you can say single blood culture for Coxella burnetii, IgG titer more than 1 is to 800. Yes, so how you can relate this Coxella burnetii? When you write the Coxella burnetii, Coxiella, Coxia, Coxiella. So this O you can do double this O. So this O and O become 8. Yes. So you can say this is 800. Yes. So single blood culture for Coxiella burnetii, IgG titer more than 1 is to 800. Yes. Or you can say uh, यहाँ पे IEA test IgG और IgM for the Bartonella, Hansnell and Quintana, the IgG titer more than 1 is to 800. So just remember Bart and Burn. Bartonella and Burnetti required only single criteria, the titer more than 1 is to 800. So this is the lab test. This is the lab test. So we covered our first major criteria is MIS means microbiological, imaging, and surgical. Microbiological is a B and L, so B for blood culture, F for lab, L for lab test. Yes. Now, lab test include the three things: PCR and a single blood culture for the Coxiella and Bartonella. Now, next thing is imaging. So, imaging include the heart, the infective endocarditis related to the heart. So heart imaging is echo. Heart imaging is cardiac CT. So cardiac CT and echo. And what finding we see? Finding is common like the vegetation, V for vegetation, valvular perforation or aneurysm, A for abscess, pseudoaneurysm, intracardiac fistula. Yes, so this is the common finding in the infective endocarditis like the vegetation, vegetation, V for valvular perforation, aneurysm, A for abscess, A for pseudoaneurysm, pseudoabscess, intracardiac fistula. Yes. Now, echo, the finding is similar in the echo also, but the significant new valvular regurgitation, if you found significant new valvular regurgitation than the previous echo, In one test also we do 18 FDG PET, 18 FDG PET. So this is the imaging. Yes, so we cover this major criteria miss microbiological imaging and surgical. So now surgical. Surgical means intraoperative things. Intraoperative direct observation of the heart. So direct inspection of the heart during the heart surgery, and if you found any vegetation, perforation, aneurysm, this is the major criteria. So now minor criteria. For minor criteria, you have to remember VIP, MIP, and F. What you remember for minor criteria? VIP, MIP, VIP, MIP, and F. Yes. So what is the full form of the VIP? So VIP means vascular, I for immunological, and vascular, immunological, and P for you can remember physical examination. VIP. MIP means microbiological, I for imaging, but this microbiological imaging criteria not set in the category of the major criteria. And P for predisposition factors. Yes. So first we are taking predisposing factors. Yes. Predisposing factors. Yes. So predisposing is a P R and E in the spelling. So PR में PRE से पढ़ सकते हैं previous history of endocarditis. PRO for prosthetic wall on PR for previous wall rupture. Previous wall rupture. So predisposing factor में क्या क्या आएगा? In the predisposing factor which thing is include. Yes, so you can say in the predisposing, pre means previous history of infective endocarditis, pre means previous valve rupture, pro means prosthetic valve. Now, say, the next is a E. So E for you can remember endovascular intracardiac implantable device means CIED. Yes, in endovascular intracardiac implantable device, and this D in the predisposition, D for the disease heart means the HOCM, HOCM, cardiomyopathy, yes. So HOCM. So we already discussed HOCM in detail with the beautiful mnemonic 1, 2, 3, 4, ABCD and the story of the 3D. You can revise. Now predisposition is the I for you can remember injection use. So these are the predisposition factors. Now fever. So fever is more than 38 degrees Celsius or 100.4 degree Fahrenheit. And V for vascular, and vascular is a SC. So in the updates of the dudes criteria, we include the two type of the vessels in the new criteria. So please remember this. This is the update. This is the update. In the updated Duke's criteria, we include the two vessels. Yes. So vascular has a in the vascular in the spelling has a SC. So S for splenic, C for cerebral abscess. So in the updates of the vascular इन द अपडेट ऑफ द वेस्कुलर क्राइटेरिया अपन यहाँ पे इंक्लूड करने लगे हैं स्प्लिनिक एंड सेरेब्रल अपसिस स्प्लिनिक एंड सेरेब्रल अपसिस नाउ इम्यूनोलॉजिकल इज as previous microbiological and imagining that not fall in the major criteria. Yes, so imagining 18 FDG with 3 month of the prosthetic wall and abnormal metabolic activity. So this duration is important. Now physical examination, new valvular regurgitation on the auscultation if echo not available. So what is in the physical examination? If echo facility is not available and you are auscultating the heart, and if you found a new valvular regurgitation murmur, new valvular regurgitation, then this is the minor criteria. So what you include in the minor criteria? Just remember VIP, MIP, and F. Yes, VIP vascular immunological physical exam. MIP means microbiological imaging and predisposition factor, and F for fever. F for fever. Yes, Dr. Vamshi, thanks for your feedback. Now, so we covered this major and the minor criteria for infective endocarditis, and this is the updated. Now we see difference how this updated criteria is differ from the previous criteria. Yes, so we see this. Yes, so what is the difference? Update to modified Duke's criteria to previous criteria. Yes. So in the pathological criteria, we cover the microorganism identified with appropriate PCR, amplicon, or metagenetic sequencing or in situ hybridization. So we are identify organism by the PCR. So we give importance to the PCR in the pathological criteria. Yes. So pathological में क्या include किया? P4 PCR, F4 amplicon, T4 in situ In situ hybridization. Yes, in the blood culture, we removed requirement of for the timing and separate venipuncture for the blood culture. Yes, in the blood culture, we removed the timing and separate venipuncture for the blood culture. So please remember this. If examiner asks the update, you don't choose that old options. Yes, criteria of the old option. Now definition of the typical and atypical organism. So we already discussed the commonly causing infective endocarditis is typical, rarely causes atypical, for commonly more than two blood culture, for rarely more than three blood cultures. How we adjust? Commonly means ज्यादा होता है तो उसे छोटा नंबर यूज करो, टू, more than two blood culture. Rarely कम होता है, बड़ा नंबर यूज करो, more than three blood culture. So typical किसको बोलेंगे? The typical organism is Staphylococcus luteolens, Enterococcus faecalis, and all streptococci except pneumococci, pyogenes, and granulicata, abditropa, and Gemellia. So how we remember this? Typical. Typical. Just remember this Staphylococcus, FL, Staphylococcus, and luteolens and Enterococcus faecalis. Yes. तो यहाँ पे क्या होगा? Yes. Please wait. Faecalis. So FL. Yes, FL. FSL you can remember. यहाँ पे Faecalis, Luteolens and Streptococci. But Streptococci not include the P. P means all the P. Pneumococcus, Pyogenes, and the PG you can remember. PG, G for Granulotica and Abdotropicus. Yes, Abdotropicus. Now, organism to be considered. टिपिकल और कौन कौन से ऑर्गेनिज्म यहाँ पे टिपिकल कंसिडर करेंगे इन द सेटिंग ऑफ द इंट्राकार्डियक प्रोस्थेटिक वॉल मटेरियल so in the setting of the intracardiac prosthetic wall material we can consider these organism as the typical all started from the CO cones yes coagulase negative staphylococci cornybacterium stricum cornybacterium jacium yes and you can say candida again starting from the co. So generally we added typical organism as the FSL. Yes, so we already discussed FSL. Yes, so Faecalis, Streptococcus and Luteolens. Yes, and Streptococcus exclude the P वाला organism. P वाले कौन से थे? Pyogenes pneumococcus and Granuli species. Uh, but in case of the intracardiac prosthetic material, we start including typical organism as the all that is started from the co. So this is the trick. It started from the co means cones, coagulase negative staphylococci, co for cornybacterium, co for cornybacterium, stratum, co for candida. Yes, and also you include Serratia and Pseudomonas aeruginosa and co for Qt bacterium acnes. So all started from the co, just a trick for the remember. Now other microbiological test, the new criteria include prestigious organism. The PCR we already discussed for Burnetti and Bartonella more than 800. Yes, so how we can remember this 800. So when you see this Bartonella has this O, and you can make this double O and make this 8. So 800. So 1 is to 800, more than 1 is to 800. Yes, this is the update. Now echocardiography findings similar to the earlier version. So you can remember echo ऐसा कैसे ही है, echo is as it is, echo ऐसा कैसे ही है, and this echocardiography finding like vegetation, valvular perforation, pseudoaneurysm. Yes, this is the common for the echo, common for the cardiac CT, common for the 18 FDG. Yes, this finding is the common. मतलब एक जैसी finding यहाँ पे मिलेगी. Surgical we already see intracardiac surgery, direct observation of the intraoperative cardiac surgery. Yes, so we don't lie on the histopathology or cardiac imaging. We lie more on the intraoperative direct observation during the surgery. That are the major criteria. So these are the important changes. What you have to remember that we remove the requirement for the timing and separate venipuncture for the blood culture, and we update the definition of the typical organism, and also we update the titer for the organism, and echocardiography finding is as it is, means the same. Yes, and now minor criteria. So minor criteria include the predisposition. So we already see predisposition is a full form of the predisposition factor, previous history of infective endocarditis, previous history of the rupture. Yes, we already see. So predisposition added to transcatheter valve implantation repair. We already see. Fever is same. Fever is unchanged. More than 38 degrees Celsius, 100.4 Fahrenheit is unchanged. So you can remember fever forever same. Fever forever same means fever is same in the previous and updated ones. Vascular criteria included both vascular. See carefully. Vascular is a SC. So S for splenic, C for cerebral. Yes. So added splenic and cerebral abscess. Yes. So you can easily appreciate vascular has a SC, S for splenic, C for cerebral abscess. So these criteria include added splenic and cerebral abscess. Now immunological phenomena added the immune complex mediated glomerulonephritis. Immune complex mediated glomerulonephritis. Now microbiological criteria added the PCR we already discussed, amplicon and metagenetic sequencing. And this imaging include the PET CT evidence less than 3 months of the cardiac surgery, and physical examination include new auscultation of the regurgitation murmur when echocardiography not available. So these slides, and we will share this slide on our Telegram group. You can easily revise. And this is the recent update in 2023. So 1 year happened this update. So question may be asked from this criteria. And as you know, infective endocarditis is a very important topic, and we already created a complete session on the infective endocarditis from A to Z. Yes, so PDF and the session already uploaded on the topic group. So this 2 page is a simplified version of this difficult criteria. So you can see this original criteria now. So these slides include the original criteria. So we already simplified for you, and you can see, you can read from the Telegram group. I will share the slides now. So definition of the endocarditis, clinical criteria. What the clinical criteria, how we define? You can say two major criteria, one major or three minor criteria, or the five minor criteria. So you can remember this. How you remember this? 2 + 0 मीन्स टू मेजर क्राइटेरिया, 1 + 3 मीन्स पहले आप लिखोगे यहाँ पे मेजर, फिर लिखोगे यहाँ पे माइनर. सो टू टू मेजर क्राइटेरिया. Yes, or you can say one major or three minor, or you can say five minor criteria. Now, possible endocarditis. Possible endocarditis is 1 + 1. One major, one minor is possible. Yes, minor criteria is only three minor criteria is possible endocarditis. Rejected endocarditis is from alternative diagnosis explaining the sign symptom. Yes, lack of the recurrence antibiotic therapy for less than 4 days. So, a patient recovered by the less than 4 days antibiotic therapy, then this is not infective endocarditis. If there is alternative diagnosis, there explaining the sign and symptom, this is not a infective endocarditis, you can exclude. No pathological or microscopic evidence of the infective endocarditis in the surgery and the autopsy. Yes, we already discussed surgical criteria is included now. The does not meet the criteria for the infective endocarditis as above. So ये सब कुछ था यहाँ पे. Updates क्या आया था? Definition of the infective endocarditis according to 2023 Dukes International Society for the Cardiac Infection Disease Infective Endocarditis. Yes. तो इसमें कोई डाउट है तो आप कमेंट सेक्शन में पूछ सकते हैं. कोई यदि अपने अपडेट करना हो तो वो भी अपन अपडेट कर सकते हैं. सिंपल सा है, केवल इतना से याद रखना है आपको. क्राइटेरिया में क्या है? मिस एंड वीआईपी एमआईपी एफ. सो जिनको निमोनिक पसंद आया वो कमेंट सेक्शन में केवल निमोनिक ही लिख देंगे. यहाँ पे मिस, मेजर मिस एंड वीआईपी एमआईपी एफ. जस्ट रिमेंबर दिस टू थिंग्स. VIP measure miss and VIP MIP and F you can easily appreciate, and please remember this minor like the fever is forever same, echo is as it is, echo ऐसा कैसे है. Yes. And which thing is included and excluded. Yes, so thanks for the participation. If you need any this type of the session, need in a minute session, we can finish important topics in the just 2 to 5 minutes, as your exam is very early. Yes, so we are not taking the longer session, just we are taking the 2 to 5 minute session. Yes, thanks for the participation. Please keep revising the topic group. Yes, thanks for the participation.